stroke in another like 6 hours, 12 hours, 24 hours, 48 hours. So they have to be monitored very closely. We try to manage them medically, but if the collaterals fail, then they need an urgent intervention. So even patient looking fine, therefore every patient should have CT angio and acute stroke to look if there's a large vessel occlusion, then you have to be prepared that even patient is fine, they may deteriorate further, mild symptoms, but they will have bigger stroke later on, and you have to be ready for an intervention at least. Then recon, very thin recon to thick recon to look for these small subtle findings, otherwise one will easily miss them. So again, neuroradiology opinion, as I said, thankfully I am from radiology, neuroradiology background, it helps us. That becomes very critical till you're looking for, otherwise when we, अगर आपने thick section करा है छोटे flaps दिखेंगे नहीं, and you'll miss the whole diagnosis that why a stroke is happening or whatever it is. So what you realize, all is a very simple procedure, local anesthesia, you go, block of the middle artery, which is extremely safe, and slowly the leakage stops and the body is also resorbing. So it is leaking and body is resorbing, then body resorption takes it over and they go away. We have done many such cases, it's beautiful procedure. Like patients on anticoagulants, antiplatelets, you don't want to do surgery, old people, you just embolize the middle artery. And as you mentioned, whenever many hospitals, even in India now have a protocol that every patient subdural collection embolize it pre-op because this 20 to 30% recurrence rate, placing drain there for 3 days, trying to
occlusion of this internal carotid artery. There was a dissection involving this segment. So what we did was we did an angioplasty and then followed it with stenting and revascularized this particular artery. So in large vessel occlusion, if the patient is fluctuating, it is worthwhile doing an angiography to look for the circulation in that particular territory. If it is not adequate, to go ahead and intervene. The last part is to look at patients who have had large core. Again, evidence has come in the last.
So just to say, so there are patients with large vessel occlusions and collaterals, they may be fine.